on, Jenna. I'm going to be your nurse practitioner today.
Hi, nice to meet you.
So today what we're going to be doing is a full head-to-toe assessment. It should take about 30 to 45 minutes. If you have any questions, concerns, just go ahead and stop me, okay? Alright, so what I'm going to start with first is going to be just kind of observing your skin and making sure that it's kind of even throughout your body. So just from an inspection, skin looks to be appropriate ethnicity in all four of her extremities, in her chest, in her legs, in her face. I can't see any vascular discoloration or lesions that would worry me. So next, what I'm going to do is go ahead and feel her skin in all four extremities. So I'm going to start here and kind of work my way down her arms. Her skin is warm and dry. Chest is warm and dry. I'm going to go all the way down her legs to her feet. And color and warmth is the same in all of her extremities. Skin is dry, warm, no lesions that I can see on her body. Patient looks to be well kept, looks to be stated age. I'm going to check her skin turgor up here. Turgor is good, which is indicating that she's well hydrated. Next, I'm going to go ahead and just look at her hair. Hair looks to be blondish brown, evenly distributed throughout her head. And then I'm next going to go ahead and take a look at her nails. And her nail angle appears to be about 180, which is appropriate. No signs of clubbing present. And at this time, I'm going to also examine her toenails, which are painted. But once again, no indications of clubbing, no fungus. Nails are smooth. I'm going to check capillary refill in her uppers. Capillary refill is less than 3. And now I'm going to check it once again just by pinching her toes, right where her toenail is, and watching for color to return, which is also less than 3 seconds. I'm going to move on to inspecting and palpating the head and scalp. So I'm just going to thoroughly kind of go through and take a look, separating her hair. And also make sure you get the back. And then I'm going to go ahead and feel it as well for any bumps, lesions, anything that would be of concern. Okay, so I didn't feel anything, no bumps, no deformities. Skull and scalp look to be appropriate for patient size. No lesions or trauma to the head or scalp noted. And then I'm just going to take a look at her face. Face looks to be symmetrical. Features are appropriate. Once again, no trauma or lesions that I'm concerned about right now. Negative for any tics or tremors of the face. And I'm going to go ahead and palpate the frontal and maxillary sinuses, as well as the masseter process for any tenderness. Just let me know if you feel any tenderness here, okay? Any tenderness? No. I'm also going to do the masseter process. What about here? Okay, so negative for any tenderness in her sinuses. And then next I'm going to go ahead and just move on to her neck. So just with her looking here, neck looks to be symmetrical. Trachea appears midline. No deformities, no protrusions. I'm going to have you go ahead and roll your neck for me. Move it up and down. Move it side to side. Okay, patient appears to have full range of motion of her neck. Any problems doing any of those exercises? No. Okay. And then now I'm going to assess her thyroid. I have to come behind the patient. So I'm just going to place my hands. Have you kind of look up a little bit? Then I want you to swallow. Okay, so the thyroid does raise while she swallows and then returns into place. Right now I'm just kind of palpating. Once again, no masses, no protrusions, any tenderness, no swelling either. No nodules were present upon palpation of her neck. So what I'm going to do next is just going to go through and I'm going to palpate your lymph nodes. So I'm going to start with preauricular, postauricular, occipital, sternocleidomastoid, submandibular, submental. I'm going to go to anterior deep, posterior cervical, and then supraclavicular. Any tenderness with that palpation?
No.
So there was no tenderness noted. I didn't notice any enlargement of any of the lymph nodes. No swelling, no redness among any of her lymph nodes as well. So next I'm going to go ahead and auscultate. I'm going to take a listen to your temporal artery for any bruits. I'm also going to listen over your eyes for any bruits, and then going to take a listen to your thyroid for any bruits. And I'm going to be making sure to use the bell of my diaphragm to do this. So I'm going to start with her temporal. No bruits noted in her temporal. I'm going to listen over her eyes now. No bruits over her eyes either. And now I'm going to take a listen to her thyroid. No thyroid bruits either, which is all a normal finding. Next, I'm going to palpate her temporomandibular joint for any TMJ. So I'm going to have you go ahead and open your mouth, close, and have you open again, and close. So there's no crepitus or clicking or popping of the jaw when she opens and closes her mouth, which is a normal finding. So I'm going to move on to vision testing. You can go ahead and put your glasses on. And I'm going to start with checking your vision fields. So I want you to just follow my finger into the 6 cardinal fields of gaze. I'm watching for any nystagmus, any problems with her following my finger. Okay, and now I'm going to do another vision test. I'm going to have you focus on an object behind me. I want you to kind of look towards me, though. And, focus on something behind me. Something on the wall, anything. Okay. I'm going to put my finger here, and when I tell you, I want you to look at my finger and follow my finger all the way into your nose, okay? So go ahead and look at my finger. Follow it all the way into your nose. Good. So pupils restrict, and then her eyes both begin to look inwards towards her nose, which is a normal finding. So we're going to move on to the Snellen chart. And this is a smaller Snellen chart. A normal one you'd be about 6 meters away, but this one you only have to be about 6 feet. So it's a little bit altered from the typical one you'd see in most eye doctors. So I pre-measured 6 feet. I'm going to step to where my 6 feet mark is, and I'm going to have her complete the Snellen test. So what I want you to do is, with one eye covered, I want you to read the lowest line possible.
DHJEF.
Okay, and then I'm going to have you uncover and do your other eye. That's okay, just do the best you can.
Okay. EFTZO.
Okay, so in her right eye, she had 20/40 vision. In her left eye, she had 20/30. We're going to do it one more time with both her eyes open.
CFDHJ.
Okay, and so then with both eyes open, she's about 20/25 vision. And that is with her wearing her glasses.
I need new.
Okay. So next I'm just going to go ahead and inspect and kind of palpate the eyes. So just looking at her eyebrows look to be symmetrical. Just going to move your hair out of your face. Eyebrows look to be symmetrical. Hair is evenly distributed on her eyebrows and eyelashes. Her orbital area is symmetrical. I don't see any redness or swelling to be concerned about. No protrusions or trauma noted. Eyelids are negative for any ptosis, which is like drooping of the eyelids. No tremors or redness able to be seen. I'm going to go ahead and take a look. I'm going to go ahead and pull down right here and look at your conjunctiva, which is a nice pink color on both sides. Her sclera is white. Okay, her iris is brown. And her pupils, I have to measure right here. And her pupils look to be about 3s bilaterally. Irises, like I said, are a nice brown color, symmetrical there as well. So next I'm going to take a look and make sure her pupils are responding to light. So here's my light source. And right now I'm just making sure that both of her pupils restrict when a light is shined in her eyes. So I'm going to start over here with the left eye. Okay. And it restricts from about a 3 or 4 to about a 1 or 2. And same thing with her right eye, restricts to about a 1 or a 2. So another thing I'm going to look at, I'm going to have you look straight, is I want to see that when I shine my light in this eye, her other eye also restricts. Which it does. And I'm going to do the same thing on this side. Okay. Like I said earlier, we already completed the accommodation test. Normal findings there, no nystagmus. Lacrimal gland looks to be intact without any excessive drainage, redness, or swelling. We already did the 6 corneal fields of gaze, so I'm going to do a corneal light reflex, which I already completed with shining the light into her eyes. And now I'm going to be doing the ophthalmic exam, which I'm going to be looking a little bit deeper into her inner eye versus what you can just see on the outside. So I'm going to go ahead. Okay, and I'm going to start on this side of the patient. I'm going to start with her right eye. So you're just going to kind of look straight ahead. And at one point I will ask you to look directly at the light, but I will give you a heads up for that, okay? Gotta get it focused first. Okay, lens is clear. Go ahead and look directly at the light. Okay, red reflex is present. Retina is an orangey color. No lesions are noted. Her veins appear to be larger than her arteries. And disc looks to be an oval shape. And I'm going to do the same thing into your left eye, so just kind of look forward for me. Okay, once again, lens is clear. Red reflex is present. Go ahead and look directly at the light. Good. Disc is an oval shape. I'm going to get real close, okay? Good. Once again, veins are larger than the arteries. So with that, concludes our ophthalmic exam. I'm going to go ahead and just switch my head to my otoscope just because I know that's coming up, so I'm going to do that really quick. Okay. So next, what I'm going to do, I forgot to mention that when I had her look at the light, I was looking for her macula, and it's only visible when the patient looks directly at the light, which hers was visible when she did shift her eyes to look directly at the light. So next, I'm going to go ahead and move on to testing the ears. So I'm going to go ahead and kind of just observe her ears, inspect her ears. And they look to be symmetrical. Visually, I can't see any trauma, any drainage, any redness or swelling to her ear area. I'm going to go ahead and palpate for any tenderness, any warmth, any swelling. So you go ahead and let me know if you feel any tenderness here at your auricle, mastoid area, any tenderness here. Okay. So next what I'm going to do is I'm going to assess the whisper test. So I'm going to have you plug your right ear, and I'm going to whisper a word down here, okay? And I just want you to repeat it.
Apple.
Good. And we're going to do the same thing over here.
Banana.
Good. Any ringing in your ears? Anything like that? Okay. So next I'm going to do a Weber's test. So I'm going to get my tuning fork, and what I'm going to do is I'm going to make it vibrate, and I'm going to place it in the center of her head. And what we want to hear is that she feels the vibrations on both sides. Which side do you hear the feel the vibration? Both ears? Okay. So that's a normal finding, and that's what we want to see. And next, I'm going to be doing the Rhine test, where I'm going to strike my tuning fork, place it back on the mastoid process, and when she feels the vibration stop, I move the tuning fork to her ear, which she should be able to hear the vibrations longer through air conduction than bone conduction. So, tell me when you stop feeling the vibration. Can you hear it now?
Yes.
And tell me when you can't hear it.
I
Okay. And I'm going to do the same thing over here on her right side.
Stop. Stopped.
Okay. So that is a normal finding because sound waves travel quicker through air than they do bone, so you do typically hear longer than you feel the vibration. And I'm going to go ahead and do more assessment and inspection of the face. Now we're focusing in on the nose. Nose looks to be normal size and shape. Let me know if you have any. I'm going to have you remove your glasses. Any tenderness? No tenderness. No tenderness noted. I'm going to have you look up. I'm going to shine a light and just take a look inside. Okay, good. No cartilage displacement or masses noted upon inspection. I'm going to hold one nose. I'm going to block it. I want you to breathe out. Good. Okay, nares are also patent. Septum is midline. And patient's negative for any drainage, redness, swelling. Next, I'm going to go ahead and take a look at the mouth. So lips appear to be symmetrical, nice pink color, no lesions, no chapping, no cracks. Teeth, I'm going to take a look inside your mouth. Okay, teeth all appear intact, no cavities, no missing teeth. She has good dental hygiene. The gingiva and the buccal mucosa look to be a pink color with no lesions. I'm going to go ahead and have you open your mouth again, and this time I'm going to look back at your uvula and your back palate. Okay, uvula is midline, and back palate is a nice pink color as well. Tonsils are present. Look to be like a 1+, normal size, normal color, no drainage, nothing to be concerned about there. And the posterior wall is also intact. So next we're going to be moving on to chest and lungs. Patient looks to be breathing at a normal rhythm, unlabored, doesn't seem to be having any shortness of breath or problems with that. So what I'm going to do next is I'm going to assess for symmetrical chest expansion. So I'm going to go ahead and feel down here. I'm going to have you take a deep breath. Good. And so what you're looking for here is you want, when you place your hand kind of under the ribs in the anterior position, you want both sides to expand at the same rate and at the same depth. So I'm going to do the same thing up here anteriorly. Go ahead and take a deep breath. Good. Once again, it's symmetric anteriorly. I'm going to have you turn to this side just so they can kind of see your posterior assessment. And you're going to do the same thing under the costovertebral angle. Go ahead. Good. And then up at the top of the back as well. Perfect. So chest expansion is symmetrical. I'm gonna just take a look. I'm gonna have you turn to the side. And typically I would have the patient like remove their shirt or just be in their sports bra, but go ahead and just breathe normally for me. And you're gonna be assessing here for any accessory muscles being used when breathing. And from what I can tell, there are no accessory muscles being used while she's breathing. I'm going to go ahead and take a listen now to her lungs, anteriorly, laterally, and posteriorly. And once again, I'm going to have you kind of turn kind of as back as you can. Like, can you go put your legs that way? And kind of angle yourself towards the back, like that way if you're able to. Perfect. Once again, I'd be doing this typically without a shirt on, so I could do just skin, but for video purposes, I'm not going to have her remove. Okay, good. So breath sounds are clear in all lobes of the lung, anteriorly, posteriorly, and laterally. No adventitious breath sounds to be noted. So what I'm gonna have the patient do next is I'm going to have her lay down.
This way though.
Lay down with your head towards the top of the bed, please. Or you know what? I'm sorry, you can sit up. I'm not ready for you to lay down. Okay, so now I'm just going to palpate as she's breathing. So I'm just going to go ahead and feel her back as she breathes. What I'm checking here is for like any crepitus, any subcutaneous crepitus, which would be kind of like a popping or like crackling sensation. Which patient is negative for. So next I'm going to go through and I'm going to do an assessment for tactile fremitus. So basically what I want to do is I want to feel bilaterally and I want you to go ahead and say 99.
99.
Every time I move my hands, just keep saying 99.
99. 99.
Okay, I'm going to have you face that way. I'm going to check your back.
99. 99. 99.
And you can just go ahead and stay facing that way. She had equal vibrations on both sides, which is a normal finding, and that's what we want to see. Next, we are going to measure the diaphragmatic excursion of this patient. So if you're able to, can you turn as far like that way? There you go. Perfect. And so what I'm going to do is I'm going to kind of move from the scapula, like the point angle of the scapula, which is about right here. And it's going to mark kind of the 7th intercostal space, which is what we're looking for. And I'm going to go ahead and have her palpate down and feel kind of the end of her diaphragm. Okay, and what I want you to do is I want you to take a deep breath and then hold it. Okay, you can go ahead and release. I'm going to kind of make a mental note of where this is right here. And I'm going to go back up to that spot and kind of palpate down. And then I want you to take a deep breath, blow it out, and then hold it with all your air blown out. Okay, so this would be your measurement of diaphragmatic excursion, and you want to see about 2 to 3 centimeters, and that would be a normal finding. I'm going to do the same thing on this side. Okay, take a deep breath for me and hold it. Okay, and then I'm going to have you release. Take a deep breath, release, and then hold it when all your air is blown out. Okay, and it looks to be within a normal range of 2 to 3 centimeters. It is normal sometimes for the right side to be a little bit higher because of the liver pushing on the diaphragm a little bit, but hers look to be pretty equal. Next, I'm going to do a vocal resonance test. So what I'm going to do is I'm going to take a listen, and I want her to I'm going to have her say a word. And basically what I'm looking for is that it is the same, strength, volume in both lungs. Go ahead and say apple.
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 Banana.
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 Okay. And vocal resonance sounded like it was equal bilaterally. So you can go ahead and turn back here. And now what I'm going to be doing is I'm going to be assessing her pericardium. So I'm going to be sitting to the side. And I'm going to be just kind of assessing her sternum. Her apex will be down here. And then I want to also be looking for any pulsations, any heaves, any lifts. And just to be noted, I'd also be checking kind of like under her breast area here. But for video purposes, I'm not going to be doing that. So no heaves or lifts are present. No pulsations, which is normal. So next, I'm going to palpate the pericardium. And so I'm going to have you go ahead and lay back. Good. So what I'm going to be doing right now, first I'm going to check for her apical impulse. I'm going to palpate once with her laying flat, which is good. I'm going to have you roll on your left side, and I'm going to continue to palpate. And it goes away when she's on her left side. You can go ahead and lay back. Next, I'm going to just feel for any thrills. So I'm just going to palpate with my hand, and I'm going to go kind of all over her chest. And just, thrills are kind of like a pulsation feeling. So heaves and lifts you can see, but thrills you have to palpate. I'm just going to kind of move down her chest using the palm of my hand. Negative for throws. You can sit back up. And now I'm going to go ahead, excuse me. Now I'm going to go ahead and auscultate. So first I'm going to auscultate with the diaphragm. I'm going to start at the aortic valve. Now the pulmonic. Erb's point. Tricuspid. And then the mitral. And I'm going to go back through now and listen with my bell in the same locations. Aortic, pulmonic, Erb's, tricuspid, and mitral. Okay, no murmurs were noted. S1 and S2, no S3 or S4. Rhythm was regular. Rate was regular. No adventitious heart sounds. Next, I'm going to go ahead and listen to S1, S2 and kind of compare where it's louder. So first I'm going to listen while she's sitting. Okay, so S1 is greater than S2 at the apex, whereas S2 is greater than S1 at the base. And now I'm just going to have you lean back. You don't have to scooch all the way back. No, lay down. Yep. And I'm going to listen again. Once again, you can go ahead and sit up. Once again, S1 is louder than S2. At the apex, S2 is louder than S1 at the base. So next, we're going to move on to our abdominal inspection, which I'm going to have you go ahead and lay back. This one's going to be mostly laying down. Okay, so what I'm going to do first, I'm going to go ahead and pull up your shirt. Okay. So first and foremost, I'm going to the side of the patient, and I'm going to be inspecting for skin characteristics. Patient has a little bit of striae, which is normal. Skin color is appropriate. I'm just really taking a look at the abdomen from the side angle. I'm going to have you raise your head a little bit. And right now I'm looking for any muscle protrusions, any hernias, which I do not see. So you can go ahead and relax now. I'm going to go ahead and I'm going to listen to your bowel sounds. I'm going to start in the right lower quadrant and kind of work in a clock-like circle. Bowel sounds are active in all four quadrants, and at this time I'm also going to listen for any bruits. So I'm going to start up here at the aorta, to the renal, and I'm using my bell and my diaphragm. Iliac, and then femoral. If the patient is negative for bruits, I'm also going to assess for carotid blue. I'm going to have you hold your breath. Go ahead and breathe, and then hold your breath again. Okay, patient is negative for bruits. And bowel sounds are active in all four quadrants. So now what I'm going to do is I'm going to lightly palpate her abdomen using the palm of my hand. And I'm assessing for any tenderness. You're going to kind of move in like circular motions. You're feeling for any masses, tenderness. Next, you're going to deep palpate with two hands. You're going to feel good around the umbilical ring. No bulges or masses present. So now I'm going to try to palpate the liver border. And you're going to kind of start mid-clavicular line and work your way down first. In a healthy person with no liver enlargement, you don't feel this. Now I'm going to work my way up at the mid-clavicular line. Like I said, I cannot palpate her liver. Palpating liver would kind of indicate enlargement. So another way you can palpate is if you place a hand here and you kind of push up on it, and then you kind of stick your hand here and take a deep breath. Okay. So what you're looking for here is when they take a deep breath, it kind of pushes the liver into your hand. Once again, I cannot palpate that. And now I'm going to try the hook technique, where I'm going to kind of hook my hands underneath her rib cage. And I'm going to take a deep breath. Once again, liver is not palpable, which is a normal finding. So now I'm going to go ahead and assess the gallbladder with Murphy's sign. And it's on her right side, kind of medial to her mid-clavicular line. And what I'm going to do is have her take a deep breath. Any tenderness. Okay, so that's a negative Murphy sign. If she took a deep breath and there was tenderness, that would indicate maybe an infected gallbladder. because when the gallbladder hits the hand, it would hurt. So next I'm going to go ahead and check her spleen. So what I'm going to do here is I'm going to lift her up towards me and palpate under here. Take a deep breath. And I still can't palpate the spleen, which is a normal finding. So for the kidneys, I'm going to place one hand on her back. I'm going to kind of palpate together. Same thing here. Kidneys are not palpable. I'm going to go ahead and feel for any aortic pulsations, which I cannot feel. Next, I'm going to percuss the abdomen, and what I want to hear is tympany. I'm going to percuss one finger flat on her stomach, and I'm just going to go ahead and hit that. Okay, and I heard tympany in all 4 quadrants. Next, I'm going to try to measure her liver borders, which in a normal person would be about 6 to 12. So once again, I'm going to start up here. And I'm going to start listening for dullness. So I'm going to kind of make a note of where that is. Then I'm going to start from down here and work up and try to find the lower border. And it's like right here. You can hear the change in sound. And I would estimate that to be about 8, which is a normal finding as well. Next, I'm going to go ahead and try and palpate for splenic dullness. And really, this only really changes if, the sound really only changes if her spleen is enlarged. So once again, I'm going to palpate up by her spleen on the left side. I'm going to palpate, take a deep breath. Go ahead and blow out. No changes in the sound of her percussion, which is meaning that her spleen isn't enlarged. You typically only hear this if the spleen is enlarged by like 3 times. Next, I'm going to go ahead and listen for the gastric aorta bubble, and what you do is you work your way down from the midclavicular line on her left side, and you percuss until you hear tympany. And her gastric air bubble seems to be right here, and it is tympany. Next, I'm going to have her sit up. I'm going to have you turn your back once again kind of towards the camera. You can go and put your foot down, yeah. And I'm going to listen now. Well, I'm going to now percuss the kidneys at the right below the costovertebral angle. I want you to tell me if you have any tenderness. Tenderness?
No.
Tenderness. Okay. Patient's negative for tenderness, which if she did have some, that would indicate inflammation of the kidney. Okay, you can go ahead and turn towards me now. I'm going to go ahead and go through peripheral vascular assessment. So I'm going to palpate the extremities, or palpate the pulses in all your extremities, and I'm going to compare bilaterally. Radial pulses +2 bilaterally. Brachial are +2 bilaterally. I'm going to move down to her feet. I'm going to do post-tibial and her dorsal pedis. I'm also going to feel her carotids one at a time. All pulses throughout the body are +2. So now I'm going to inspect for JVD. I'm going to have you lay flat. You can just lay flat right here because I'm going to sit you back up. I'm going to go over here, and I'm going to look for any pulsations, which you can see, jugular vein pulsations. And then I'm going to help her sit up to about 45 degrees, and the pulsation should go away. If not, it indicates right-sided heart failure. There you go. And the pulsations do disappear at about 45 degrees. Next, I'm going to go ahead and just kind of inspect for any venous insufficiencies that would be indicated by color changes. And like I said earlier, when I did my skin assessment, which I kind of already assessed for this, her skin is dry and warm in all extremities. There is no vascular discoloration in any of her extremities. Capillary refill was good. Any numbness or tingling? No, so it indicates that she has good blood flow in all of her extremities. I'm going to go ahead and just palpate kind of down your extremities. Any tenderness?
No.
Any tenderness up there either. Okay, so I'm going to go ahead and assess your cranial nerves. And what I'm going to have you do first, I'm going to have you shut your eyes. This one's going to test your cranial nerve 1, olfactory. I want you to tell me what this smells like.
Lemon.
Good, and this is lemon candle. Next, I'm going to do, well, I already tested her optic nerve, which was with the Snellen test and her confrontation test, which indicated earlier that her optic nerve was intact, so I'm not going to retest. Oculomotor nerve, which is nerve number 3, also was tested earlier when I did the 6 cardinal fields of gaze. I looked for nystagmus in her eyes, which was negative. Her trochlear nerve, I tested earlier when I checked for pupil reaction with light, so I do know that that is intact. So for her trigeminal nerve, which is cranial nerve number 5, I'm going to have her bite down while I'm feeling her masseter bone. And I'm also going to feel her temporal bone. And then can you try and open your mouth against my hand? Good. So her trigeminal nerve is intact. Next would be her abducens, which you would see with the conversion test. I already tested that, and that is intact. Next would be her facial nerve, which is cranial nerve number 7. So I'm going to have you close your eyes, give me a big smile. You can open your eyes, puff your cheeks out, frown. Okay, so cranial nerve number 7, facial nerve is intact. What I'm going to do next is I'm going to assess her glossopharyngeal nerve, which is cranial nerve number 9. I'm going to look at your uvula while you say ah.
Ah.
And her uvula raises. Another way to test this is to test her gag reflex, which I'm not going to do. Next is going to be her spinal accessory, which I already saw she has good range of motion, but go ahead and move your head side to side, up and down. Good, and then shrug your shoulders for me. Good. And lastly is the hypoglossal, which is cranial nerve 12. Go ahead and stick your tongue out, move it side to side, intact. So next I'm going to go ahead and assess cerebellar function, assessing coordination. So I want you to go ahead and do finger to nose. Shut your eyes and just kind of alternate and touch your nose with your fingers. Now I'll tell you when to stop. Keep going a couple times. Good. And next I want you to go ahead and take your shin, or your heel, and slide it all the way down your shin. Good. Do it with your other leg. Good. Next we're going to do the Romberg test. I'm going to have you stand up, hold your arms out, shut your eyes. And right now I'd be assessing for any swaying, movement, which she is negative for. So she has negative Romberg's test. So I'm going to have you take a couple steps towards me. Turn around and take a couple steps the other way. Good. And you can have a seat. So her posture is good. Stride and arm movements are appropriate. No problems with gait. So next I'm going to go ahead and test her sensory function. And what I want you to do is just kind of tell me shut your eyes and tell me what part of your body I'm touching.
Hand. Upper arm. Knee.
Good. Next I'm going to go ahead and keep your eyes shut, and I'm going to touch your hand with something, and I want you to tell me if it's sharp or dull or how you feel.
Sharp. Sharp.
Good. So did that sharp sensation feel the same in all of your extremities? Good. Another one I'm going to do is I'm going to have you shut your eyes. I'm going to move your big toe, and I want you to tell me if I'm moving it towards you or away from you.
Towards me. Okay. Towards me.
Good. And I'm going to put an object in your hand while your eyes are closed. I want you to just feel it and tell me what it is. You can use both hands.
A Q-tip.
Good. So next I am going to test 2-point discrimination. Keep your eyes closed. I want you to tell me, I'm using tweezers. I'm either going to be touching her with one point of the tweezers or both. So I want you to tell me if you feel 1 or 2 pricks.
2. 1. 1. 2. 1.
Good.
1. 2.
patient answered appropriately in all of your extremities. Next, I'm going to write a number. Close your eyes, keep them closed. I'm going to write a number on your hand, and I want you, it's going to be 1 or 2.
2. 1.
Do the same thing over here.
2. 1. 1.
Perfect. And we already assessed that she was able to identify body areas when I touched them. So next we're going to move on to reflexes. I'm going to have you just lay flat for a second. And I'm going to test your abdominal reflex by just kind of, in like almost like a ticklish motion, striking your stomach. And her muscles should contract. And I'm going to do this in all 4 quadrants. Her abdominal muscles did contract when her abdomen was striked. Next, I'm going to do her plantar reflex, and what I want to see here, you can sit up. What I want to see here, I'm going to have to stick your leg up, is that her legs curl, or her toes curl when I strike her foot. Good. I'm going to do it bilaterally. Perfect. Next, I'm going to get my reflex hammer, and I'm going to test her reflexes, her deep tendon reflexes. Good. Okay, +2 bilaterally for her bicep. Next, I'm going to do her brachioradialis, which I'm going to turn her hand upwards. Good. Also +2. Triceps, I'm going to hold her arm up like this and strike right above her elbow. Good. Perfect. +2. Next, I'm going to do her patellar. So if you're able to kind of scooch back a little bit so your legs are kind of hanging freely. And next, I'm going to do her Achilles. And I'm going to strike right behind her ankle. Good. Perfect. So, deep tendon reflexes are +2 throughout her body. Next, I'm going to move to her musculoskeletal assessment. So, basically what I'm doing here is I'm assessing her extremities for symmetry, making sure muscle mass looks to be symmetric in all of her extremities. I'm going to assess her skin and fat over her joints, like her shoulders, her elbows, wrists, knees, ankles, any tenderness when I was palpating anywhere. No redness or swelling was noted on top of any of her joints. Muscles look to be symmetrical, and they also feel to be symmetrical as well. No spasms are noted upon inspection. Like I said, there's no tenderness, swelling, or warmth in any of her joints. I'm going to test active and passive range of motion. So I want you to just lift your arms up, put them back down, bend your arms, wiggle your fingers, straighten your legs, roll your ankles, bend your toes. Good. And I already assessed her neck that she's able to move that as well. Next, I'm going to test your muscle groups for strength. So I'm going to have you squeeze my fingers. Good. I want you to pull up towards you against my hands. Good. Push down. Good. I'm going to have you try and lift your arm. This one. Shrug upwards. Good. I'm going to have you try and kick your legs out while I hold down. Good. Go ahead and push on my hands with your feet. Good. Next, I'm going to have you open your mouth against resistance. Again. Good. I'm going to go ahead and have you push against my hand. Push back. Perfect. And I'm going to test your thoracic and lumbar spine. So I'm going to have you kind of cross your arms on your chest. And I want you to twist this shoulder into me. Good. I'm going to have you do the same thing. Perfect. Good strength noted there. I'm going to have you lay back in the bed. I'm going to assess your hips. So what I want you to do is I want you to kind of, I'm going to cross this here and then pull that way. Good. Once again, and then I want you to push against me with your leg. Good. So she has good strength pretty much everywhere. And lastly, what I'm going to do is I'm going to inspect her feet and ankles. You can go ahead and sit back up. So this is assessing here. You can go ahead and put your foot down. She has 10 toes, no swelling, no varicose veins noted, and no discoloration. Any pain when you're sitting here. Okay, I'm going to have you go ahead and stand. So right now I'm looking for any bulging veins, any color changes, anything like that, which I do not see. And her size stays symmetrical when sitting and standing. So I'm going to have you go ahead and take a seat. And that would conclude it, but I did realize that I forgot to go ahead and assess your inner ear. So I'm going to go ahead and do that now. Typically, I would have done this when I was already like palpating and stuff. All right, no redness, no swelling, no drainage, small amounts of cerumen noted. Tympanic membrane is a pearly gray color. Once again, no swelling, drainage. Tympanic membrane is a pearly gray color. And medium amounts of cerumen. So that is going to conclude our head to toe assessment. Thank you so much for giving me your time today.